This episode of Precision Opinions Live is brought to you by Vintage Labs. Vintage Labs is a professional-grade supplement and cosmetic company where each product is tested and reviewed by one of their exclusive pharmacists. Look for the pharmacist's signature on every package that ensures that the active ingredient falls within 5% of error and does not contain arsenic, lead, cadmium, or mercury. We welcome you to join the Vintage Labs collection, where they do the research for your health. Use promotional code LIVE, that's L-I-V-E, to receive a 10% discount on all orders at vintagelabscollection.com.
All right. Thank you for joining us, Precision Opinions Live today. And as you guys know, it's actually Mental Health Awareness Month. So what we're doing is we're doing one view. It's going to be $1 amount, and that's going to be donated to NAMI. I appreciate all the feedback. Obviously, it's been an awesome journey and ride. And our last edition of the series, we have Dr. David Lifschutz. Thank you for coming on. I appreciate it. Doc, I know, and you're actually the first repeat guest on the show. So this is awesome.
I'm very honored to be here.
We did it on Zoom, and now we're going to come on and talk a little bit about more openly about mental health and everything. So your background, I know last time we went over it, it's extensive. So
Right.
if you could do a little breeze through on your background.
Well, I went to medical school at University of Wisconsin in Madison, and I did my post-MD training at LA County USC Medical Center in LA, which was fabulous. I trained in adult psychiatry and child and adolescent psychiatry. But this was back in the day when we had maybe 2 or 3 antidepressants and 1 or 2 antipsychotics. So this was like 1969, 70, it's a long time ago. And things have just mushroomed now. They're just amazing how many drugs we have for mental health. But things are progressing in all areas. Back then, was early days of psychotherapy where most psychiatrists had to learn how to do therapy. Today, most psychiatrists don't know how to do therapy because they don't get it in their training. But we did. And I've been following therapy, and therapy has been progressing as well. Now, the latest iteration of therapy is something called accelerated experiential dynamic psychotherapy. And it was put together by a psychologist by the name of Diana Fosha, another New Yorker.
Mm-hmm.
And it has to do with the theory that the problem with a lot of people who have all kinds of problems is attachment. So what do I mean by attachment? It's the first several years of life when you have attachment to your mom or to whoever the mothering figure is. And that's very, very important, that you have a stable, secure, comforting, nurturing attachment. Because sometimes the match between mothers and babies isn't very good. So you get dysfunctional attachment. Sometimes you grow up in a family where there's a lot of aggression or yelling and screaming, and they say, oh, babies don't know anything. Babies are little learning machines. And if they get treated badly, it can show up in adulthood. Research in the last 10 years or so has shown that severe traumatic attachments, like babies that see a lot of trauma, people getting beat up or yelled at, or getting yelled at or beat up, result in severe limitations in the early development of the right brain. The right brain is the brain that deals with emotion, not logic, not language, but it's feelings, pictures, stuff like that. And if you're exposed to this, you have enduring deficits that go on for a lifetime. The research shows in the early 2000s it started. It's well established that the loss of the ability to regulate the intensity of emotion is the most far-reaching effect of early trauma, abuse, and neglect of babies. So people can become sociopathic. It's very similar to psychopathic personalities based on being badly treated as babies. Also, there's a diagnostic category called borderline personalities. And borderline personalities also has to do with intense, aggressive emotional states. And it's driven by brain damage that develops in babies' first and second year of life. So it's really important.
So based on, I don't want to interrupt, but
no, go ahead.
Based on this theory, they're suggesting that any sort of mental health disorder or disease, depression, anxiety, schizophrenia could be related to what went on in the first 2 years.
Not schizophrenia. Schizophrenia is a more organic. In other words, there was brain damage that may have occurred genetically or before birth. It's
but
not
personality disorders.
But personality disorders. Mm-hmm. I mean, schizophrenia is not my area of expertise, but personality disorders, people that end up in prison because they end up in rages where they murder people because they don't know how to control their anger. Mm-hmm. And this dates back to being a little baby when they did not get properly regulated or proper appropriate attachment experience with their mom. Mm-hmm. One of the things I did in my training was I was in LA when a lot of British psychiatrists were there, and I did a course with one of them about infant observation. And we had like 5 people in the course, no, more than that, 10 people in the course. Half of us were assigned a mother who was about to deliver a baby. Okay. And they would go and watch the baby and the mom every week and take notes on what was going on. And some mothers and babies are like miles apart. And you can watch the baby, a little infant, like standing on their head, trying to get the mom to mother them the way they needed. And the mother just is oblivious to this and doesn't get it. And you get other mothers and babies who are like, they're so in sync. The mother knows just before the baby wants something what the baby wants. And that's like secure attachment.
And that goes through the rest of your life.
And that goes through the rest of your life and how you feel towards people and yourself for the rest of your life. So AEDP, or Accelerated Experiential Dynamic Psychotherapy, addresses dysfunctional attachment disorders. When people grow up, and a lot of us grow up with parents who don't know how to be parents. And you have a lot of problems later in life. And this kind of therapy came about by someone who is one of my idols, because she has done so much research and figured out that whereas psychoanalysis can tell you what's wrong with you, but it doesn't really get you much better. But AEDP can get you better. And it's spreading all over the world. It's like wildfire. I was just in a seminar. We had people from Korea in the seminar. So they were getting up at midnight to attend this seminar on Zoom. It was
now, let me ask you a question.
4 days.
Has there ever been medication that they're using or studying? No.
Well, some medications can help. There are antidepressants that can help when people are depressed. But the therapy is the most important part of this to get people better. It's like antidepressants can take away some of the symptoms, but it doesn't really get your inside better. It doesn't make your right brain function better. Mm-hmm. Also, ketamine does help. Mm-hmm. I have patients who I am starting to build up a cohort of patients now who didn't realize they were damaged very early, in the first year or 2 of life, and they just want to die. And they've wanted to die for a long time, and I'm not sure sometimes what keeps them from killing themselves. Mm-hmm. Because they feel there's nothing in life that makes them feel good. And this has to do with very early damage from parents often who just didn't know any better, because this stuff is genetic. We know now that the way your parents may treat you when you're growing up can get into the DNA and is transmitted genetically. So this stuff runs in families. which is why I think it's so important that people get proper psychiatric, psychological treatment for emotional problems, so they can stop it in their generation and not have it keep going through generation after generation after generation.
So that leads me to kind of like next area, as far as what does someone do? Like, what if I wake up one day and I'm having feelings of anxiety, depression, which I don't know what it is at first. I don't know if it's just allergies and I can't breathe. I don't know if I have a headache or if it's brain fog. Is there something that a patient should do to talk to someone? What's your suggestion as a psychiatrist?
We talked a little bit about this earlier. If you wake up and you have weird feelings, what do you do? I would be tempted to call your local hospital and find out if they have a psychiatric referral base or a psychological referral base, and say you want to talk to somebody. Because, we expect that. I think it's the best thing in the world when somebody calls up and says, hey, I've got these weird feelings and I don't know what to do about them. So I'll say, come on in, we'll talk about it. Maybe we'll find out. You could call your internist, but a lot of times internists don't know. Or, there's a lot of crossover in medicine now where an internist says, oh, I can take care of this, don't worry about it. But they may not know because they weren't trained in psychiatry. So it's really important to see somebody who's trained as a mental health worker. Mm-hmm. And for example, I'm on staff at Mount Sinai Hospital in New York. I'm on their referral system. So somebody calls up, they'll say, oh, hey, we want you to see this person called up, and would you talk to him? Okay. Also, if you have health insurance that covers you, often the hospital will try to find you a caretaker, a psychiatrist, a social worker, who is covered by your insurance. So your insurance will help you pay for it. Another thing you might do is look up AEDP online, because they tell you how you can refer to this. It's sort of a new age therapy, but it's spreading like wildfire all over the world. I found out about it about 10 years ago, and it took me a while to even get involved in it. And I've already been trained as a psychoanalyst. I went back in to get into treatment with somebody who knows how to do this because I wanted to learn how to do it. I figured the best way to learn how to do it is to be a patient in it. So it's just blowing my mind, because it's a kind of therapy where they really talk to you as a person, and where you want to be in a patient's heart and mind. You want to have them in your heart and mind. And it's really caring in a way that most other therapies do not do. And, I was saying that with these patients who, for a long time, have felt like they just don't belong, nothing's much good. Sometimes ketamine is very helpful for these patients. And I know ketamine is all the rage. And, but it's really important, if you're going to go for ketamine, to see a psychiatrist who's doing it. I know, it's a very lucrative kind of thing now, and a lot of physicians want to jump on the bandwagon and, oh man, I want a part of this. But, unless you're trained in mental health care and you have good training, and it takes more than just a year or two, you need like 5-10 years training to really have an idea what you're doing. You should see people who are trained, because a lot of people who want to do this, they say, oh, I can do that, I'm a doctor, but you can't do it. It's like I wouldn't try to do heart surgery because I'd have a lot of dead bodies. But, so it's, there's a wonderful treatments out there. I mean, AEDP is not the only one, but you really need to talk to a professional who can help you understand what you're feeling, because you're having these feelings often for a reason, unless they're physical, which is another good reason to see a psychiatrist, because, we're trained as physicians. So one of our jobs is to recognize something when it's not mental or emotional, but it's physical.
So now, when you're doing ketamine therapy, you mentioned the importance of being trained in the field.
Yes.
Now, when you're giving a patient ketamine, do you usually communicate to them about what's going on in their life, what they've witnessed, how that has formed them into this individual? Because we go through our lives, and whether we've been to war or we've had traumatic experiences, or we lost a parent, or we lost a grandfather, whatever the case is, or a child.
Absolutely. I think one of the things we do as psychiatrists is, by our training, when you first see a patient, you do a mental status evaluation, and you do an evaluation where you do a history of their lives and what their lives have been like, and what their childhood was like. Sometimes it takes 2 or 3 sessions because, as most people know, somebody says, what was your childhood like? Oh, it was great, man, it was great. And they just change the subject. A lot of times when somebody tells you, well, it's great, by the time you're talking to them for the 3rd hour, all of a sudden you find out it was pretty horrible. It wasn't so great. Because people don't really think in detail. You know, if you've had a miserable early upbringing, you don't remember much of it. People that have had really great childhoods remember a lot of it. And that's kind of a little pearl that people don't realize often. Oh, I just don't remember, but I'm sure it was fine. Well, it probably wasn't. But we talk about where they come from. I sometimes will give them a piece of paper they can fill out that measures their attachment to their maternal figure. And once we have them do ketamine and we feel it's appropriate for them, we then, after the 45 minutes or hour that they're under the influence of ketamine, we talk about what they experienced while under ketamine and what came up. Now, a lot of my colleagues feel it's very important what you experience while under ketamine. Many doctors don't feel the dissociative experience.
And that would be the psychedelic side,
right,
of ketamine.
That would be the psychedelic
where
side.
they're deriving it as it's a related to mushrooms or this
yes,
or that.
A little bit. It's not quite a psychedelic like mushrooms or psilocybin or even MDMA, but you dissociate. And your mind goes places where it ordinarily wouldn't go, and you uncover things that we can then talk about and do what we call integration. And integration is making sense out of what you experienced under ketamine, given your history and how you developed and what's on your mind in general. Mm-hmm. And this is particularly helpful with patients who have post-traumatic stress disorder or chronic post-traumatic stress disorder. I discovered I have chronic post-traumatic stress disorder, and I'd had years of therapy and nobody uncovered that because most people didn't know much about trauma for the longest time. Mm-hmm. And it's very important to find that out because it helps you develop better relationships and treating your children better and treating yourself better and loving yourself more so you can be in your heart and mind. And ketamine is a wonderful medication for helping one with that.
Yeah. No, I like the idea of it's, and it has to be, I would say, the first medication that's available that has this kind of rapid working for mental health, and you take the experience that you had and you go back in time and see what do I need to improve in my life, and that's where it's different.
Yes, that is where it's different, and it also often gives you like a 3D objective view of where you are in your life. Mm-hmm. And very often, especially the first couple of times people experience ketamine, they go, "Oh my God, I never realized what I was doing." Or sometimes they'll have an experience of, you have something in the back of your mind that you should attend to, but you don't want to do it because it's painful emotionally or just, I don't want to go there. And under ketamine, you may hear yourself telling yourself, "What do you mean you don't want to go there? You got to take care of this. This is ridiculous. Get to it." Mm-hmm. And you come out of it saying, "Oh, I better do this." And also, ketamine can be very helpful with people who are actively suicidal. It can avoid going to the emergency room because with 3 to 6 ketamine IV infusions, the suicidality can go away. Maybe not permanently, but it'll go away long enough and you can start getting into treatment with a therapist, a psychotherapist, and it's very useful. It also can help with depression that other antidepressants cannot touch. And this is also why it's a very important new medication.
I know also that you didn't mention in your bio, which I was disappointed, but you are a member of MAPS.
I am a member of MAPS.
So, which is very interesting because they're doing a lot of research now. And it seems like in California and Oregon, there's some things in the works.
It's so interesting you mentioned that because I was lucky enough I have an acquaintanceship with Rick Doblin, who's head of MAPS. MAPS is Multidisciplinary Association for Psychedelic Studies. And they're doing research on the one drug that cures post-traumatic stress disorder, which is MDMA. Hopefully it'll be legalized by 2023. So people can start treating patients legally with it because it's currently considered an illegal drug. But all the research they've been doing is coming out really well with no real problems with it, significant ones. But also, I was saying that I happened to tell Rick in my email that I was starting to learn how to do AEDP. And he said, that's amazing, you're ahead of the curve because we're starting a research project in MAPS of doing MDMA with patients, and the therapy we're using for that is AEDP. And I predict, I may be wrong, but I have a feeling that it may turn out that AEDP may be the one therapy that will be felt is best for when you're doing MDMA-assisted psychotherapy, because it really gets to the heart of the trauma.
Mm-hmm.
And I think one of the things when I did my training with MAPS 2 years ago, one of the goals was to really have the patient feel that they were in your heart and mind and you really cared about them. So this was really wonderful.
Yeah. So wait, now, do you know if that's going to come out as an FDA approved medication, or would
yes.
it be something that you would go to a dispensary?
No. I think the way it's being set up now is once the third stage of the research is approved and accepted by the FDA, it's mandatory that it becomes legalized. And it's being set up so the one group that's able to legally manufacture MDMA will be MAPS. And they will market it just for people who've been trained specifically to do MDMA-assisted psychotherapy.
Wow.
And the money they make from marketing will go to helping treat people who cannot afford the treatment. So it's really, talk about being in their heart. Their heart is in it. And I really admire, another one of my heroes is Rick Doblin, who spent his life trying to get MDMA legalized and using it to help people who have been badly traumatized emotionally.
Awesome. Well, I think we have a good way of closing. I really appreciate you coming on and sharing your experience and kind of educating patients on what to do next when they have something coming up. It's been a pleasure. You're our first repeat guest. So yeah, I look forward to everything we're gonna see in the future with different medications and all. And Doc, if you can share your information, that would be awesome, for your office, your phone number, your email.
Sure.
If people can reach out, that would be awesome.
Thank you, Christian. It's really an honor to be able to do this podcast with you. My office number is 212-529-2733. My office is on at 303 Fifth Avenue in New York City. And I'm happy to get calls. I have a website called creativesolutionsPsychiatry.com, and you can contact me through my website as well. And I will respond to phone calls, hopefully within 24 hours. I like to think I can do that. I'm trying to do that. And I'm happy to help. Thank you so much for having me.
Thank you for coming on. Awesome. Thank you for tuning in. I really appreciate it. Please go to Dr. David Lifschutz's website, and he will be starting some ketamine infusions. So go check it out. And please feel free to donate to NAMI. We really appreciate every single one of you.